wakandarasi ambao wanajenga hospitali hizi. Asante Mheshimiwa Spika.
Senator for Nairobi City County.
Speaker, yesterday I was quite privileged to be invited to a show on one of the local media stations. And because during the Gen Z revolution, my numbers were circulated countrywide. Whenever I get opportunity to go to these shows, I am just inundated by messages from across the country about the things that people would want me to highlight or to bring out in those shows, Honorable Speaker. But one of the most shocking one is related to the statement that has been brought by Senator Faki regarding the lack of imported equipment in the county hospitals. Speaker, someone sent me a message yesterday saying that we don't have blood in the country because for the last 5 months, we do not have blood bags. I don't know if that's something that any one of you can picture in this house. We do not have bags for almost 5 months for people to be able to donate blood. That samples of blood that are collected in the counties have to be transported by road to Nairobi or to Mombasa for testing. That, Honorable Speaker, there are no working refrigeration equipment in our county hospitals. And by the time the results come back 2 to 3 days later, that blood can no longer be utilized. Speaker, the most shocking revelation from that particular message was that knowing the need on the ground, especially in emergency circumstances, health workers are taking chances of infusing people with blood that has not been tested because or in order to be able to save lives. So, Honorable Speaker, even donors are being told, if you are a blood donor, if you want to donate blood, you come with your own bag. So when people tell us that our healthcare system is working in this country, and you have stories such as the ones that have been told, and stories such as the ones that we're being told by Senator Faki, there's a problem with our healthcare. You know, I hear people saying, oh, if SHA is working, we should just all say it is working. Our healthcare system is broken, and Honorable Speaker, we have to address these issues. Some of the people in government are here when they count the success of the current health system. They say that the success is in the numbers of people who have registered under SHA. That cannot be the measure because SHA is not a registration bureau. We are not conducting a census. The measure of whether healthcare is working is in addressing such issues, Honorable Speaker. Can you imagine the risks that are having to be taken, being infused with blood that has not been tested, Honorable Speaker? So there's a problem and we must resolve it without hiding behind political slogans saying SHA is working. Lastly, Honorable Speaker, you are aware that I had quite a weekend. We threw quite a bash in Kitale and Bungoma counties. And we want to thank the people of Trans Nzoia and Bungoma for coming out to say no to this culture of goonism. Because all of us have a constitutional right, Honorable Speaker, to be able to meet with people, to be able to talk to people, to be able to sell our ideas. When you see things like what happened in Keumbu, it is people who are no longer able to compete on ideas. They have chosen violence in order.
Senator Fernandi.
Thank you, Mr. Speaker. So I want to make a few comments. And I'm surprised that Nairobi Senator was sweating yesterday evening, but he has the energy to castigate the government today. He could not answer those questions, so we'll make sure he sweats more. Mr. Speaker, let me comment on this issue of importation of raw sugar in the country. Mr. Speaker, under the Kenya Sugar Board, between January and May, I've consulted Kenya Sugar Board. We produced 348,143 tons. This Mombasa Sugar Refineries Limited has been allowed